This program was produced by and first broadcast on Radio Hawke's Bay, your community access media station. Thanks to New Zealand On Air for making this type of programming possible.
Good morning, everyone. This is Heiko Lada from the Acupuncture on Air show in Hawke's Bay, where we interview acupuncturists predominantly from around New Zealand, but also from around the world. And today we've got a really special guest, Jeff Shearer from Australia. Now, we'll be running a series of radio interviews with him and talking about acupuncture and Chinese medicine in treatment of musculoskeletal disorders and other problems, arthritis. So, good morning, Jeff. How are you doing?
Good, thanks, Heiko. How are you, mate?
So all is good in Newcastle?
Yeah, going great. Thanks for having me on the show, buddy.
No, that's good. No, we're pleased that you're coming on the show. Now, as this is our first show, I just thought I'd like to introduce you first to our audience, and I'm sure many of the people would be interested to learn a bit about Jeff and how he became involved in Chinese medicine, because I tend to ask that for most acupuncturists, because it can all be really quite different as opposed to just sort of you leave school and you decide to do acupuncture. So I know that these days there is a larger percentage of people who are going straight from school to acupuncture study, but what about you, Jeff? I understand you had a bit of a progression from massage to acupuncture. Can you fill us in what happened in your life?
Yeah, look, I ended up, when I left school, I worked in, weirdly enough, a bank for about 18 months.
We won't hold that against you.
But it was the last office I ever worked in.
Yeah.
And look, I felt like I didn't really know what I wanted to do, so I ended up travelling for about 3.5 years around Australia and overseas, and I got to a point where I decided it was time to come home. And I thought to myself, well, I've been working in bars and restaurants and kitchens and digging holes for a living at that point, and I kind of came to the conclusion that wasn't really for me long term. And I thought, well, what is it that I really want out of a job? And there's a psychological kind of technique, a psychology technique. Ask someone the question, and the first thing that comes into their head's the answer. So I asked myself, what would it be that I want out of a job? And the answer that came to me was I wanted to be able to go home at the end of the day and feel like I'd done something worthwhile, feel like I'd done something that mattered. To me, it wasn't about, selling trinkets or making lots of money. It was about having some heart, I suppose, in what I did. And so the next question I asked myself was, what was that? And massage popped into my head. And so off the back of that, I came back to Australia and signed up for a Cert 4 in massage therapy, and that sort of began my journey.
All right, fantastic. And now I think I can understand why you actually have the reputation of being the travelling Aussie acupuncturist, because from the little I know about, you've moved from Queensland, you set up, you get really busy, and then next thing I look, he's in the Northern Territory now. And then I look at that, and then, hang on, he's not there, and he's now back in New South Wales. So you've got this sort of travelling bug. So tell us a bit about the moving and why you like moving around the place.
Look, Heiko, I've never really felt home anywhere, and I think there might be a bit of, I've got some Indigenous blood, so there might be a bit of that, a bit of walkabout going on.
Yeah.
But I've sort of always find I set something up and I feel like I want to move on to something else once I've done that. So I had, I think it was about 4 clinics in Brisbane. Another
Only
two
4?
Clinics up the sun. Yeah. 2 in the Sunshine Coast in Queensland, and then eventually decided to hit the road for a while, and we went travelling for about 5 months and ended up in Darwin for about 3 years. And then after that, we moved down to Newcastle. And I have to say, Newcastle, as soon as I got here, I felt like I was home. So I think this is going to be where I pull up stumps, my friend.
Yeah, well, that's I really envy you, because look, I'll be 65 next year, and I still don't know where I want to live. So
spring chicken, mate.
So I've moved around and had different clinics, like all over Sydney and all over New Zealand, and but yeah, so I can see a bit of you in me, and and now even in Hawke's Bay, I've moved 3 times, but the opposite observation that I know about you is that, and it's also, is you're a bit of a seminar junkie, a bit like me, and looking at your resume and seeing all the different masters and courses and things that you've done. and then, embracing those styles or modifying those styles. I personally recently have just started taking on using the Master Tung style acupuncture, which I know that you have taken on board. But tell us a bit about your acupuncture journey in terms of your sort of academic and experience direction after graduating from college.
Yeah, look, I think when I graduated, Heiko, there wasn't a lot of really good quality seminars. A lot of them were like little half-day, 4-hour kind of things where you just kind of dip your toe into something. And when I was in Darwin, I suppose I'd been doing, as you know, a lot of work with teaching practitioners about running business. So my focus was kind of splintered a little bit. And when I went to Darwin, I kind of really decided that I wanted to take some time to kind of delve in a little bit more to the practice side of what we do. I felt like for a long time I didn't really have a clear kind of understanding of what I was doing, and so I ended up doing a course with Dr. Tan, Dr. Richard Tan, rest in peace, and that was an absolute,
eye-opener. Yep.
Yeah, and so I pretty much went back to my practice from day one and said to all my clients, I don't do what I was doing before. So I used to do soft tissue and acupuncture and all sorts of other stuff. And I said, I just do acupuncture now. And I didn't lose anyone. And pretty soon, within a month, I went from running one room to running 2 rooms because I just had so much more time on my hands, and I was getting, amazing results. And then I ended up doing some Master Tung stuff with Brad Wisnant initially, and then I did some with Henry McCann and Wei Chi Young, and that really opened my eyes a lot further in the sense that I think essentially Tung has a much more specific approach than Tan, and so I found it much more efficient, much faster, and for me I found the results again, they scaled up another level. And then more recently, I delved into a style called neoclassical acupuncture, which isn't very well known, but that was an absolute game changer.
Okay.
And stuff. And now these days, it's pretty rare that I use any more than one needle and still get extraordinary results. So I'm really grateful for the teachers that I've had.
Fantastic, yeah. Now, how do you find it like when you're with new patients experiencing acupuncture for the first time, and for example, whether you might be using one of the Tung methods or you're using one of your one needle techniques?
Yep.
How do you explain it to the patients how it works? Because as you know, patients sort of coming and you got a sore thumb, they want you to stick it into their thumb, sort of thing. So how do you get around that?
Well, look, I very much use a Western sort of explanation and sort of explain to clients that essentially what we're doing by putting a needle in is we're activating the sensory nervous system that feeds back into the central nervous system. And as a result of that, it means that we don't necessarily have to needle the area of pain to see a solid change. So what I've certainly noticed for myself, and I'm sure you'll probably the same, quite often someone might come in with shoulder pain, but you identify a whole bunch of other issues that are going on at the same time. And you might put in a couple of needles and you can see all of those things change almost together. So it's like a cascade effect.
Yeah.
And so I sort of explain it in terms of the central nervous system is doing kind of like a bit of a reset, I suppose, where it's going back to its central point. And so everything that's not in alignment starts to come back into alignment.
Yep. And I know, of course, that there's been quite a bit of a turnaround from you as opposed before you were going to seminars, but now you're actually teaching at seminars. And so tell us about your travels and the topics that you have taught.
Yeah, look, Heiko, I became very passionate in the sort of early 2000s in the issue that's quite predominant in our industry, where there's a very high attrition rate. So when I left college, I think it was 2% of graduates were still practicing 5 years after they graduated. And for me, I considered that a big part of that was most practitioners really have to go out and start a business. There's not many jobs available where you can go and work for someone else and gradually hone your craft while you're earning a bit of an income. And so, for a good, 2009 till about 2017, I was running business training. So we talked about communication, how do you communicate with your clients, how do you ensure client retention, being able to talk to clients about treatment plans, because we know that, one treatment is usually not enough to be able to treat an issue.
Yeah, sorry, just to jump in there, but I think you're going to be talking about this. Is it in August in Brisbane at another seminar?
I've got another seminar in October.
Oh, right, okay.
Oh, sorry, no, yes, you're right. I am. There's a business conference in August.
Yeah, so you need a PA like me to remind you what you're doing.
I tell you, it's all getting a bit out of control these days. I've got no time for clinic.
Yeah. But the good news is that you will be presenting to us your full workshop in Christchurch next year. Now, just tell us a bit about this workshop, because I'm going to it, so I'm a bit excited about it. So, what's the topic?
Yeah, I'm really excited, Heiko. I've had some wonderful feedback from the first seminar we ran. I had 5 veterans who pretty much the same era as myself, who were blown away by the approaches that I take. And what we're really looking at is being able to identify musculoskeletal issues in the big picture. So what are all the contributing factors? There's a big aspect of palpation. So we're not taught a lot of palpation in our training, and this is one thing that I've found has been incredibly effective for me in being able to diagnose what's going on for someone, and also being able to identify whether the needles that I'm using are actually having the effect that we want, but also getting feedback for the client to be able to show them that, can you see how the neck has changed? Can you see how the lower back has changed? And being able to, for them to be able to identify what's going on, rather than just this idea of, I'm going to put some needles in, let's hope it works. We're also going to look at some stretching and strengthening exercises, which I find is quite often sadly lacking in our training.
Mm-hmm.
Because quite often someone might have a structural issue that's related to excessive tension associated with work that they do or physical activities. And so being able to counter that with particular exercises that help them to be able to recover more effectively and more rapidly.
Oh, that's really great. So I'm looking forward to that workshop. And so it won't be till next year though. But yeah, I'm looking forward to it.
Me too, my friend.
Yeah. So listen, we're just about out of time. So, but thanks for coming in and joining us on the show. And we look forward to seeing you again on our next show. When I know we're going to talk more specifically about some musculoskeletal problems. And obviously this will include injuries. But will you be able to discuss anything about arthritis? Because I get a lot of people asking about acupuncture and arthritis.
Yeah, absolutely. Yeah. Treat those sorts of things all the time, and so we can certainly discuss that, Heiko.
All right, now that's really great. So see you all soon, and when we interview Jeff again, all the best.
Good on you, mate. Thank you.
This program was produced by and first broadcast on Radio Hawke's Bay, a community access media station. Thank you to New Zealand On Air for making this type of programming possible.